I'm delighted to be here to discuss the remarkable progress being made in the development of plasma, so important therapies. These therapies transfuse powerful antibodies from the blood of recovered patients to help treat those battling the current infection that we all know so well. Plasma is one of the more delicate ways of doing things. It's had tremendous response so far we've had, and it's an effort to really accelerate new therapies and further reduce mortality.
Thank you so much for joining us today and for shining a light on the critical need for convalescent plasma. I'm honored to be seated here with these distinguished top medical experts who are striving to help us deal with this terrible pandemic. And I am so grateful that the American Red Cross can actually play a role in the treatment of COVID-19. We're helping to collect units of convalescent plasma, which I've been told is showing promising results, and it's treating COVID patients. We've shipped over 24,000 units so far, and I am in awe of our donors who are donating convalescent plasma. They struggled through this disease, they came through the back end, they have precious antibodies, and hospitals are transfusing their plasma into patients that are struggling mightily with the disease themselves. And it's a testament to the generosity of the American public. These donors have recovered from a debilitating disease, and they're willing to lend an arm to help somebody they probably will never even have the opportunity to meet. And in fact, blood donors in general are just so generous. They are helping save someone's life, and they do it without question, and it's just an amazing, amazing thing. Americans always step up, whether it's a pandemic or a hurricane, and it's a privilege to be able to see the generosity of the American public over and over again, whether they're volunteering, donating blood, or even providing us with financial donations. So on behalf of the entire American Red Cross, I want to extend a heartfelt thank you to the people that actually recovered from COVID-19 and are giving this remarkable gift of life to help them recover as well.
Thank you very much, Mr. President, for support of this very important program. When we talk about what is going on in this country and the challenge we're facing, we often say that it's something where we are all in it together and we all have to pull together. An important part of the process of being in it together and pulling together is helping each other. You know, and I can think of nothing more manifesting the helping of each other than someone donating from their experience of being ill. And this is something that I think is part of the American spirit, and we should be proud of it and we should show it. So it's a very important thing. It's an important part of the entire response to this outbreak. I want to mention that when we do something like give convalescent plasma, it's important to understand, as several of us have mentioned, that it is an important part of the spectrum of interventions and response. We have good therapies and we'll get better therapies for people with advanced disease. We have the dexamethasone for people on ventilators, the remdesivir with people with hospitalized who have lung involvement, and now we're talking about another important part of intervention. It's the intervention early in infection to prevent people from needing to go to the hospital. And that's really what convalescent plasma is, because the mechanism of it is directed against the virus. It's taking the machinery that France has spoken about that the body makes to get a protein to block the virus. And that's exactly what this is all about. Now, it's also important to point out that this could be a proof of concept, because when antibodies work, it tells you a few things. It'll tell you that when you have a vaccine and you induce antibodies, it could work. And this is the good news that's juxtaposed to what happened a couple of days ago when we went into a phase 3 trial for a vaccine. Some of you may have heard me say that I was cautiously optimistic, a word that I use often, that we will be successful with a vaccine. One of the reasons is that in the phase 1 study, the vaccine induced response that was comparable, if not better, than what we see in convalescent plasma. So here's where the work of vaccine essentially merges with the work we're doing now with convalescent plasma. So that's the reason why we think it's so important and why it's so important for people to donate. Thank you, Mr. President.
Thank you very much, Tony. Thanks.
Thank you, Mr. President, and thank you for lending your voice to the day's important call to action and really making the 2 critical points of what we're calling every American to do. Thank you for noting how important it is for every American to give back by wearing a mask, by socially distancing, and from avoiding crowded places where they may not be able to social distance or wear a mask. And we know what we're talking about, parties and bars. Thank you for also really calling to action for those who have recovered to donate life-saving plasma to others. And I think these 2 pieces together, knitted together to stop the spread of the virus through mass social distancing and avoided crowded spaces, either indoors and outdoors, and protecting the vulnerable, and at the same time calling for action to increase our therapeutic abilities to treat more patients. Thank you.
The death toll is now 150,000. What is the current projection going forward? What should we expect in the next couple of months?
Well, I'd let perhaps Tony, do you want to discuss that, please?
Look at it, we almost will not have enough that would be utilizable, particularly not only for the administration, but also for what was just mentioned about the supply of the hyperimmune globulin. So really an unlimited amount. There really is as many as we possibly can get, in the hundreds of thousands.
Are you going to recommend that Americans wear goggles as well as face masks to defend against the virus? Is that going to become a new CDC recommendation?
Well, I can tell you I only heard of goggles for the first time about 1 hour ago. Now I'm hearing about goggles. So I don't know. Deborah, do you want to discuss that?
So I believe Dr. Fauci talked about this yesterday, but we have in the hospital systems and having for exposure have had people using face shields, and I think you've seen them through my tour through the United States and 14 states across the country where the president sent me to make sure that we were combating the virus well on the ground. Tennessee has created teachers, special teacher packs to ensure that every teacher has a face mask, a face shield, gloves, and hand sanitizers. And I think we're trying to bring these best practices back to ensure that teachers feel safe in the classroom in the same way that doctors and nurses feel safe in the hospitals to decrease their exposure.
I think when you look at Miami, by the way, or Florida in particular, it looks like things are getting much better. Arizona getting much better, heading down, heading in the right direction. Some other areas getting much better. Could be catching on, unfortunately, in a couple of areas we don't know quite yet, but we'll be able to report that soon. But some very big progress being made in some of the states that 2 weeks ago looked like they were going to be quite bad. And some great progress made. All right, any other questions, please?
Tom Howell, Washington Times. Are you concerned at all about the lag time it takes to get a test back? We've heard reports a week or more. A gentleman from LabCorp talked about that a little bit. What's going on there? Has there been improvement?
So we're getting mostly now, we're ordering as many of the immediate tests, which is 5 minutes to 15 minutes, even a little bit less in some cases than 5 minutes. But we're trying to get those tests. We have pretty close to 50%. I call them short-term tests, but we're up to about 50%, which is amazing. The other tests, while good, you have to send them. Then they have to do the work, and they have to send them back. So the process takes long just in terms of delivery. We really are liking the short-term tests where you find out immediately whether or not you have a problem, and that's what we're striving for. But we're already up to approximately 50%. Is that correct, Deborah?
I think with the new antigen tests that are available now to nursing homes, that will really help our turnaround times to get them out more specifically. But you have charged us to get that turnaround time down across the board, and we're working with FDA to make pooling available. The reason LabCorp has been able to decrease their turnaround time so remarkably is they moved to pooling several weeks ago. That's dramatically increasing our throughput throughout the country. And so we really need to call on all the laboratories to learn from LabCorp and others that are doing pooling like the Broad and LabCorp to really increase our turnaround times, to decrease our turnaround times. We know that it's possible that we can decrease it by at least 50% if all of our laboratories move to pooling. So, sir, we're doing as you said, and we're going to decrease those turnaround times.
Good, thank you. And how is LabCorp doing about turnaround?
Yes, so right now, Mr. President, for priority patients, those in hospitals or those in nursing homes and hotspots, within 1 day we can turn them around.
That's great.
For everybody else across the country, we turn those around in 2 to 3 days on average. And we can do 180,000 of those tests per day, and we're still increasing capacity. And as Dr. Burke said, we're going to be doing pooling and multiple other things, so we will continue to work hard.
So then for nursing homes, 1 day and something more than that for everyone else, but 3 days looks like it's a pretty good target.
Yeah, well, on average, 2 to 3 days. So we shoot for 2 to 3 days. So if we can get it to 2 days on average,
that's
even
really,
better.
that's very good. Would be happy with those numbers. And numbers that we are happy with, and we use a certain test around here that goes very quickly, and it's just been recently developed. So we've done an amazing job. Everybody at this table has done really an amazing job in coming up with testing and testing that works. Steve, go ahead.
One issue that has come up is once you do have a vaccine, how do you properly distribute it? How do you get it out quickly to millions?
Well, when
of
we
people?
have the vaccine, we have the military all lined up, and the military is going to be doing it in a very powerful manner. These are people that don't usually do vaccines. They do soldiers, and they do lots of other things that frankly are more difficult. But we have our general, and logistically, he's all set. Tony, do you want to say something about that?
That is correct. As the vaccine rolls out, we'll be getting them distributed. And as you probably have heard, we are going to make sure that we do it in an equitable way, and it's representative of the populations who need it the most. And we have the standard way that we determine that with the ACIP working with the CDC, but Dr. Collins and Dr. Redfield have put together with the National Academy of Medicine a group that will fortify that decision-making process so that we're making sure that we're very fair and equitable in getting the vaccine distributed properly.
And I think I could have Francis say that tremendous progress has been made on the vaccine beyond anything that we would have thought if you go back 6 months. What do you think?
It is just, frankly, quite astounding, Mr. President. I've been at NIH for 27 years and director for 11, and I've seen some amazing things happen. But the way in which the whole research community, public and private, philanthropies, everybody has come together to work on this, not worrying about who gets the credit, trying to figure out how to strip away anything that's going to slow things down. And I think all of us, motivated by the fact that this is the most serious problem we've encountered in our professional lifetimes, even a day matters. And so that's why a lot of people look kind of sleepy, because we're all working 24/7, trying to make sure that nothing possibly slows this process down. Yeah, the vaccines, this week is a big week, as you just heard, having 2 phase 3 trials started in the very same day, this past Monday. And based upon very impressive phase 1 data showing that people who got that in the phase 1 trials developed these high levels of neutralizing antibodies that should be very predictive of protection, but you don't know until you actually run the trial in those 30,000 people. By the way, you heard earlier about coronavirus.gov, which is the place you can go to find out how you can donate plasma. There's another thing you can do if you go to that website, which is to sign up to say you're interested in a vaccine trial. And we need people to volunteer for that as well, because we're going to, with these 4 or 5 trials coming along very quickly, each of which needs 30,000 volunteers, that's a lot of people, and we need them.
And Francis, we're working very well with other countries.
We are indeed, and science has always been international, and it certainly is right now. And we work with our colleagues in Europe and the UK and Asia in a way that I think represents the best of the best. And again, everybody recognizes we're all in this together across the whole planet.
Okay, thank you very much, everybody. Thank you. Thank you.